Hi, today I will talk about the hepatic portal system. The hepatic related to the liver and the portal system, the system which starts in capillaries and ends in capillaries before the blood enters in the right atrium of the heart. I am repeating again, the system which starts with capillaries and which also ends in capillaries before the blood reaches in the right atrium. The less oxygenated or the poorly oxygenated blood enters in the right atrium from the upper part of the body through the superior vena cava and inferior part or below the diaphragm. With some exceptions, the blood return in the heart by the inferior vena cava. But there is some portal like system in the GIT or especially the abdominal part of the GIT. Exceptions are, there are some exceptions like the anal canal and the lower part of the rectum, and there are some other systems, other parts of the body which are also having the portal system. So, this system is known as hepatic portal system. Hepatic portal system. The other portal system of the body is inside the brain or cranium, and it is related to the hypophysis, so known as hypophyseal portal system. What is the significance of this portal system? This question can arise in your mind. So, this portal system, the hepatic portal system, is related to the nutrients which are absorbed in the GIT, and the liver is the highest center of the metabolism. So, these nutrients are first coming to the liver, and after completion of the metabolism and absorption and detoxification of the nutrients and blood is reaching in the right atrium. This hypophyseal portal system is related to the pituitary gland and the hypothalamus, and this system is related to the endocrine hormones. So, this lecture is on the hepatic portal system. The main component of this hepatic portal system is the portal vein. The portal vein, also known as the splenic, also known as the splenic, mesenteric, confluence. So, a big vein or big vessel of the body and having the length of only 8 centimeters or 3 inches and the width is 2 centimeters. A big vessel of the body but having only 3 inches length and 2 centimeters width. This hepatic portal system can accommodate up to 1/3 blood of the total body blood volume. So, out of 5 liters, it is around 5 liters. So, 1/3 of this 5 liter volume of the blood at a given time can be held by this hepatic portal system. Besides this accommodation to the blood, this system also provides nutrition to the liver. When we see the blood supply of the liver, 80% blood, this is the liver, 80% blood to the liver is supplied by this portal vein, and 20% blood is supplied by the hepatic artery. So, this blood is coming from the right ventricle, and this blood is coming from the GIT or the abdominal part of the GIT. So, 80% and 20% ratio in the vascular supply of the liver. When we talk about the nutrition, 66 to 75% nutrition to the liver is from the portal vein, and remaining 25 to 34% is from the hepatic artery. So, I will talk about, first of all, I will discuss about the formation of the portal vein or splenic mesenteric confluence, how this portal vein is formed and how this portal vein is giving branches like the artery. So, first of all, the formative tributaries of the portal vein. Behind the neck of the pancreas, the endocrine gland and exocrine also a long fleshy gland having head, neck, body and the tail. Tail of the pancreas is reaching up to lino-renal ligament. So, we can see this tail in the lino-renal ligament, the folding of the peritoneum which is connecting the spleen and the left kidney. So, it is connecting the spleen, hilum of the spleen and the left kidney. So, this is the lino-renal ligament. It is reaching up to the hilum of the spleen. This head and neck is surrounded by first part, second part and third part of the duodenum. So, this is the first part, this is the second part, the third part and the fourth part of the duodenum, ending in the duodenojejunal flexure at the level of L2 vertebra here, and the confluence of the portal vein is also at the level of the L2 or lumbar second vertebra. So, blood is poor in oxygen, so it is bluish color. Here it is the splenic artery coming from the hilum of the spleen, splenic artery, and this is the superior mesenteric artery. This is posterior part of the neck of the pancreas. So, these are the formative tributaries of the portal vein. The splenic vein is receiving the inferior mesenteric vein, which is draining the blood from the hindgut, that is the left 1/3 of the transverse colon, the descending colon, sigmoid colon and the upper part of the rectum. The superior mesenteric vein is draining the blood from the midgut and the derivatives of the midgut like the part of the pancreas, the right 2/3 of the transverse colon, ascending colon, colon, cecum, and the jejunum, ileum and the part of the duodenum from the major duodenal papilla and the third part and the fourth part of the duodenum. In 40% cases, about 1/3 cases, in 1/3 cases, this inferior mesenteric vein is directly draining in the confluence of the splenic vein and the superior mesenteric vein. So, this is the inferior mesenteric vein, this is the splenic vein and this is the superior mesenteric vein. In about 1/3 cases, this inferior mesenteric vein is directly draining in the confluence of the splenic vein and the superior mesenteric vein. In remaining 2/3 cases, out of these 2/3, in 60% cases, it is draining in the splenic vein and in 40% cases, it is draining in the superior mesenteric vein. So, the formative tributaries of the portal vein is highly variable. Again, I am repeating, the in 1/3 cases, the inferior mesenteric vein is directly draining in the confluence of the splenic vein and superior mesenteric vein. In remaining cases, 60% in 60% cases, it is draining in the splenic vein and in remaining 40%, it is draining in the superior mesenteric vein. So, these are the formative tributaries of the portal vein. This is the portal vein passing behind the first part of the duodenum. This is the first part of the duodenum. So, for the anatomical description the portal vein is divided in three parts. This is the infraduodenal part, retroduodenal part and supraduodenal part. So, in relations of the first part or the infraduodenal part of the portal vein, in front of the portal vein we can see the neck of the pancreas. In its lateral relation we can see the bile duct which is opening in the major duodenal papilla. So, this is the opening of the bile duct. And the posterior relation is having the inferior vena cava. So, inferior vena cava is behind the infra or inferior duodenal part of the portal vein. The lateral relation is having the bile duct and the anterior relation is having the neck of the pancreas. So, these are the relations in the first part. The second part is retroduodenal. The anterior relation of this part is the first part of the duodenum, the gastrohepatic artery on the left side. It is having the gastrohepatic artery and laterally it is having the bile duct which are separated by the first part of the duodenum. So, again relations of the retroduodenal part, it is having the first part of the duodenum, the part of the gastropancreatic artery, gastrohepatic artery and the bile duct. The posterior relation is having the inferior vena cava again. This part is occupied by the inferior vena cava posteriorly. These are the anterior relations. The relation in the supraduodenal part are interesting. We can see the liver, and this is the duodenum. This is the pylorus of the stomach. The first part, second part, third part and fourth part of the duodenum. This part is occupied by the head of the pancreas and this is the neck of the pancreas. So, there is formation of the portal vein behind this neck of the pancreas and it is ascending upward behind the first part of the duodenum and in front of the inferior vena cava. Here we can see the right free margin of the lesser omentum. This is occupied by the lesser omentum. This part of the lesser omentum is known as gastrohepatic ligament. and this part of the lesser omentum is known as the hepatoduodenal ligament, and this is the free margin of this lesser omentum known as hepatoduodenal ligament. This free margin of this hepatoduodenal ligament is having three structures. Anteriorly, I will draw the transverse section of this free margin here. Anteriorly, it is having the proper hepatic artery in its anterior and right part, the common bile duct in anterior and the right part, anterior and left is the hepatic artery, and the posterior part is having portal vein. And these all are ascending in the free margin of the lesser omentum in the hepatoduodenal ligament. So, anterior and to the left is the hepatic artery, anterior and to the right is the bile duct, this is the hepatic artery, this is the bile duct, and behind these two there is the portal vein. This is the space occupied by the portal vein, and behind the portal vein there is a foramen or foramen of Winslow, epiploic foramen or foramen of Winslow. Or foramen of Winslow, this is the only connection between the greater sac and the lesser sac, which is behind the left lobe of the liver, behind the lesser omentum, and behind the second and third layer of the greater omentum, and behind the stomach. So, this is the part of lesser sac, and here it is the part of the greater sac. So, it is only connection between the greater sac and the lesser sac. On reaching the liver, the relations of the portal vein is different. Anteriormost in the liver is the hepatic duct. Hepatic duct, which is bringing the bile from the liver. Posterior to the hepatic duct is the hepatic artery, and posteriormost is the portal vein. So, these are the relation in the liver. Anteriormost is the hepatic artery, the middle anteriormost is the hepatic duct. This hepatic duct is bringing bile, and this hepatic duct, the right and left, are joining each other and forming the common hepatic duct, which ultimately joins the cystic duct and form the common bile duct. Posterior to this hepatic duct is the hepatic artery, that is the middle one is the hepatic artery, and the posteriormost is the portal vein. Before entering in the liver, the portal vein divides in the right and the left branches. Right branch is shorter, left is longer and obliquely placed, right is shorter and more vertical. It is also receiving the cystic vein, and the trunk of the portal vein is receiving the right and left gastric veins. So, these are the tributaries of the portal vein. The left one is also receiving the paraumbilical veins, which are coming in the falciform ligament and ligamentum teres. Ligamentum teres is remnant of the umbilical vein or obliterated umbilical vein. So, this is the left and this is the right branch of the portal vein, and these all are entering in the liver. Portal vein is devoid of valves, it is not having the valves like other veins. So, it is having the flow towards the liver. So, it is valveless vein. This is not a typical vein, it starts in the capillaries and ending by forming the right and the left branches of the portal vein, and ultimately it will end in the sinusoids, which are the type of the capillary. So, portal vein is initiating in the capillaries inside the GIT, and it is also ending in the sinusoids, which are also capillaries inside the liver parenchyma. This part of the liver is known as porta hepatis. So, this is the port of the liver, where all these structures are entering or leaving the liver. Sometimes it is also receiving blood from the pre-pyloric vein and superior posterior part of the gastroduodenal vein. In some cases, or rarely, it is the left part is connected to the ligamentum venosum. It is the ductus venosus during fetal life. So, sometimes there is patent ductus venosus, which is very rare. So, these are the tributaries of the portal vein. So, here the splenic vein, the inferior mesenteric vein, superior mesenteric vein, and this is the portal vein. This is the left branch and this is the right branch of the portal vein. Right is shorter and vertically positioned, left is obliquely placed and longer, and these are ending in the porta hepatis and entering in the liver parenchyma. So, now this was the part of the infraduodenal, the part of the retroduodenal and part of the supraduodenal, and this is the intrahepatic part. This is the part of liver where the right and left are entering. In 10 to 15% cases, there is trifurcation of the portal vein. Trifurcation. In the case of trifurcation, this right is having two branches, the right lateral and the right medial. So, this is a case of trifurcation of the portal vein in right lateral, right medial and the left portal vein. Now, the course of the portal vein inside the liver is very interesting. Why it is interesting? Because liver is supplied by the venous blood as well as arterial blood, and it is also having some cells which are forming the bile. It is having the hepatic sinusoids and it is having the biliary canaliculi. What happens inside the liver? This is a typical hepatocyte. It is hexaxial. So, this is typical hepatic lobules. Liver is having 4 lobes which are again divided in 8 lobes functionally and anatomically, and it is also having some small functional units known as lobule. On the angles of lobules there are portal canals. These are the portal canals. The portal canal is having 3 components. The components of the portal vein, the component of the biliary system or bile duct, and the arteriole of the hepatic artery. Central part is having the central vein. This is the component, venous component, which will ultimately drain the blood from liver to the inferior vena cava and the right atrium. So, this is the portal canal or triad. It is having the component of the hepatic artery or hepatic arteriole. It is having the component of the, this is the component of the hepatic arteriole, this is the component of the portal vein, and this is the component of the biliary duct or bile duct. What happens inside the hepatic lobule? This blood from the portal vein, this is oxygen deficit or poorly oxygenated blood, which is coming from the abdominal part of the GIT after exchange of gases in the viscera of the GIT. This is the component of the hepatic artery, which is bringing the richly oxygenated blood from the left ventricle of the heart, and this is the biliary component which is draining the bile from the lobule of the liver. Inside the liver, I will not go in detail of the histology of or microanatomy of the lobule, but it is having hepatocytes, and it is having biliary canaliculi. It is having macrophages, Kupffer cells, hepatocytes. These are the hepatic sinusoids. So, blood from the portal vein is entering in the hepatocyte. Blood from hepatic arterial component is also entering in the sinusoid. So, this is the space of the liver. The hepatic sinusoid is the space of the liver where the blood from the portal vein, this blood is nutrient rich but oxygen deficient or poorly oxygenated but rich in nutrient blood. This blood is rich in oxygen but poor in the nutrients. So, both bloods, 80% blood is supplying to the liver and 20% blood is supplied by this hepatic arteriole. Both bloods are mixing in hepatic sinusoid, and this is the biliary canaliculi. So, after filtration and detoxification of this blood of portal vein, the bile is entering in the biliary canaliculi and ultimately this is draining in the biliary duct. So, this is the drainage of the bile from this biliary canaliculi, and this is the mixing of the portal and the hepatic arterial blood. Ultimately, after filtration and detoxification and after gaseous exchange from the hepatic arterial component, blood is entering finally in the central vein. And finally, this blood is entering in the sublobular vein, then in the hepatic vein, then in the inferior vena cava, and finally in the right atrium. So, this is the peculiar feature of the portal vein, that it is bringing the blood, the less oxygenated or oxygen poor blood from the viscera of the GIT. Blood is coming to liver after exchange and detoxification of the nutrients and after completion of the metabolism. Blood is entering in the central vein and in the sublobular and inferior vena cava through the hepatic veins, and finally the blood is going into the right atrium. So, what is the significance of the portal vein? It is bringing the nutrient rich but oxygen poor or poorly oxygenated blood to the liver, and after completion of the metabolic activities, blood is entering in the heart. So, this is the significance of the portal venous system or hepatic portal venous system. So, we have seen the formation of the portal vein, the valvulus system portal vein, and it can accommodate up to 1/3 blood of the total body volume at a given time, and it is bringing the nutrients to the liver. What is portocaval anastomosis or portosystemic anastomosis? There are some places, about 5, 6 or 7 places where the mixing of the portal venous blood and mixing of the vena cava blood is taking place. In my next lecture, I will talk about the portocaval anastomosis or portosystemic anastomosis.